And I very much welcome the national COVID-19 vaccination strategy announced on Tuesday by the Government. I would like to raise the point of vaccine allocation sequencing. I welcome the approach of prioritising those who are over the age of 65 and are residents of long-term care facilities. We have seen a rapid spread of COVID-19 over the course of the pandemic in certain areas relating to people who are part of that age group. And I think we have to try and deal with that first where possible in terms of the vaccination rollout. We are all aware that it is a major challenge, and in terms of fatalities, unfortunately, in many cases it's been a very difficult experience for many older people in our communities who are very worried about COVID-19. And I've been listening to some of my colleagues here in the House today and around misinformation, and that is something on a political level that has become a major challenge in Irish politics over the last number of years, but particularly in 2020, which is a general election year. We have to be absolutely clear with the public that the vaccination is a very clear way for our population to deal with this outbreak of COVID-19 in terms of getting onto a future without it, and recognising as well that vaccinations last Ceann were a major part in the eradication of multiple diseases and multiple illnesses throughout the course of modern human history. And I think it is absolutely outrageous that we have members of this House that are willing to come in here and I think pander to the message of anti-vaxxers in this country, which is disgusting. The COVID-19 vaccine has seen more investment than any other vaccination in history throughout the planet to deal with this pandemic. It has very sadly ended the lives of millions, of hundreds of thousands of people, should I say, throughout the European continent and North America, and here in Ireland as well, has sadly ended the lives of so many people who were not only without any underlying health conditions, but so many people who had underlying health conditions. And I think the message from government has to be absolutely crystal clear that we need to embrace the vaccination. And also, I'd like to say on the record of the House that when it is available to me, I will take that vaccination. You know, Minister, you put an awful lot of work in your role. You know, it's a job that I think very few Ministers for Health, as you're well aware, very rarely get thanks, and people can be very easily critical of the job that you're doing. But I think the Government has done everything they can, and I think the people who are involved in the task force have been fantastic. I'm delighted to see some very decent names of a lot of good experience in working in logistics, from the IDA to our academia and our universities. And I think that's critically important, so there's public confidence in the vaccination rollout. But to add to that, last Ceann, I think it is important that we would continue to look at other areas alongside the vaccination strategy, which we do know is going to take some time before it's going to be available to everybody, and continue to look into matters such as antigen and research into the area of antigen. And we can't forget that Ireland is home to many of the world's leading pharmaceutical companies, and I could be stand to be corrected, but from my recollection, 9 out of the top 10 pharmaceutical companies in the world have their European headquarters in Ireland. So we are at the forefront of the war on COVID-19, and we should lead the world in terms of our research on this issue and our messaging with our European colleagues as well on further research into this area. And I'm very hopeful, as the youngest TD in the House and the youngest TD elected to the Oireachtas in quite some time, that the work we are doing now as a society, as backbenchers supporting this government, and on an international level, will in the future hopefully allow us a better ability to, I suppose, deal with upcoming illnesses and diseases and new pandemics when they do arise. So having the template of this task force is a very good thing for the country and for public health in Ireland. And I think it would be remiss of me if I didn't mention the extraordinary efforts that were put in by our frontline care staff in Ireland, by those working on the front line of the COVID-19 pandemic. And they've borne the brunt and the consequences of this. We have to support them in every way possible. So, Minister, I want to wish you well. I think that the work that you're doing will never be forgotten, and you mightn't be thanked for it for some time. But I do have to admit that the one thing I heard a lot of my colleagues here talking about it was around misinformation, and it is highly irresponsible for members of this House, without any basis on fact or on science, to be engaging in that style of a debate. And I'm just conscious it's my final time speaking here for the year of 2020, last Ceann. I'd like to wish everybody here in the houses of the Oireachtas and my constituents a very happy and peaceful Christmas, and I'm very hopeful that next year will bring some better times for everybody. Gormaína Magat.